Good evening, ladies and gentlemen. It's me, Quratulain, a clinical psychologist and mental health therapist. Today, we are going to start our second lecture. As we all know, basically, we will be studying about our course paradigm today. In this course, when we launched this course, we have already discussed our perks, our framework about it. We will be discussing about the diagnosis of the psychopathology. We will be talking about the practical manifestations of the psychological issues and the behavioral indications of those issues as well. We will be talking about the treatment and management plans of most disorders according to the DSM-5, including the intellectual disability, autism, ADHD, learning disorders, depression, schizophrenia, bipolar, conversion disorder, disruptive behaviors, anxiety, and obviously obsessive compulsive disorder and anger management, including the interpersonal conflicts separately, and the basic psychopharmacology will also be overlooked in each disorder and its states. Certain assessments will be recommended as per our cultural regards as well. So let's begin our lecture for the day. Today, we will be talking about the intellectual disability. When we are talking about intellectual disability, according to the DSM-5 TR, obviously being a psychologist, we have to practice it. Intellectual disability or the intellectual developmental disorder basically have been called as a mental retardation in our previous eras, right? But when the recent version of the DSM was published, this term was replaced with the intellectual disability or intellectual developmental disorder, because the mental retardation term was so frequent at that moment that it was actually getting stigmatized over the period of time. All right, people were getting so conscious to be called about this term that the person having this kind of disturbance was more frequently having a very determinant exclusion from the group. All right, so the revised diagnosis took place, and now the mental retardation is called the intellectual developmental disorder. But you have to understand one thing, that when the changes begin or in our DSM, there are certain changes that have been made in the diagnostic criteria as well. Firstly, we will overlook that comparison. First of all, as we have talked about the name displacement, the second thing is DSM-5TR have removed the multi-axial system or the categorical system that was being practiced in the DSM-4 in the very late period of time. Now, it was considered that there is no longer a reliance IQ score that can determine the inclusion for any person to be included in this group of disorder. All right. Or instead, subtypes are being classified for the individuals having this kind of disturbance as mild, moderate, severe, or profound. It depends on the level of severity they are having or they are facing right now. All right. So basically, this was decided at that moment that the intellectual disability can no longer be practiced just because on the basis of the IQ scores. Rather, there would be another domain which will be included in diagnosing the intellectual disability. That is an adaptive functioning, individuals' practical daily life functioning skills. All right. When we are talking about the intellectual disability, now we are coming towards the criteria of DSM-5, specifically about the I'm sorry, I think I was not sharing the screen previously and no one just bothered to let me know. So I'm sorry about it. But let's just start from here. All right. The first criteria for the intellectual disability in the DSM-5 TR is the deficit in intellectual, or you can say the intellectual functioning or the developmental functioning in general. All right. We will describe the intellectual functioning and the adaptive functioning later, but first you have to understand that these are the frequent or the specific criteria that has to be met when we are diagnosing any person with any kind of psychopathology. All right, you have to defend it first. Okay, so the first one is the deficit in the intellectual functioning, and the second criteria is the deficit or impairment in the adaptive functioning of the individual. But that should be compared with the individual age, his gender, and his socio-cultural matched peers. All right. You first have to consider these things also. And the second thing is the problem should begin in the early developmental period of the age, right? Then here comes the severity index, as we have studied earlier here. Intellectual disability basically have been comprised of the 4 major stages, all right, depending on the adaptability or the adaptive functioning. Okay, so these are the 4 categories: mild, moderate, severe, and the profound. Okay, the other 2 categories will be understandable later, so we will discuss them like in the end of the class. Here comes what it actually meant to be these kind of problems. Okay, let's start here. Okay, it's a very defined form for you guys to understand what is intellectual functioning. And if we are talking about the deficit in the intellectual functioning, it means individuals' particular reasoning skills, problem solving, planning, abstract thinking, judgment, academic learning, learning from the experience or the practical learning, confirmed by both clinical assessment, individualized and standardized intelligence testing. That is a very frequent question asked in the vivas or in the all right. So these are very frequent questions asked in the vivas or in the interviews, that what actually intellectual functioning means. These are the things that are being compared in the intellectual functioning or the individual's performance, all right? When it comes to the adaptive functioning, then we are actually talking about developmental and socio-cultural standards of an individual for the personal independence and for the social responsibility, or you can say the individual complete independence regarding his particular age comparative to his peers. All right, so without ongoing support, without assistance, all right, that person should work independently just in their particular age. Okay, but in case if a person is having deficit in the adaptive functioning in one or more of the activities, all right, daily functioning such as the communication, such as the independent living, daily living skills, all right, how to brush his hair, how to brush his teeth, how to wear the socks, all right, and how to manage the groceries, how to calculate the groceries, how to make the list, all right, and across the multiple environments such as like home, school, working community, peer groups, and all that. If a person is facing this kind of trouble in one or more activities, then it will be called as deficit in adaptive function. All right. And that deficit will be considered in the 4 categories as we have discussed earlier, as we have seen it in the 4 groups. All right. Mild, moderate, severe, and profound. Okay. Here, all right, if we are talking about the adaptive functioning at the very major level, then it have the 3 domains to be covered. All right, daily functioning depends on your 3 basic skills: your conceptual skill, your social skill, and your practical skill. All right. But if if being a person, I'm talking about the conceptual domain, that it will include your daily living skill regarding your problem solving in language, in reading, in writing, in reasoning regarding the maths calculations, in your knowledge and your memory. All right. If I'm talking about the social skill of an individual in comparative to the adaptive functioning, then I'm actually talking about the pillar of the person's adaptive functioning in compared to the awareness of the other's experiences. All right. The empathetic responses, the interpersonal communication skills, the friendship abilities, social judgment, self-regulation. I'm talking about all that thing. All right. If I'm talking about the third pillar of an individual's adaptive functioning, then actually I'm talking about his practical management. All right, self-management across different life settings, arranging his chores, his daily life activities, performing his reading responses. All right, including his personal care, job responsibilities like money management, recreation, doing his bed well. All right, managing one's own behavior, his responses. All right, organizing the school and work tasks, obviously. So these are particular things you have to consider when we are talking about the adaptive functioning. And if a person is having deficit in one or more of these things, then we will call it as a deficit in the adaptive functioning. All right. So it will be considered in the 4 levels, either mild, either it will be called like the severity level of the problem. Right? So it will be mild, moderate, severe, and profound. Now we will see all those pillars in comparative to the severity level, right? When we are talking about the mild level in terms of the conceptual domain or the conceptual pillar, basically for the preschoolers, there may be no obvious conceptual differences, right? Because that is a very early age for an individual to understand anything, but they will be having difficulty in learning the academic skills involving reading, writing, arithmetics, time, money. Obviously, when we just take our child to the school, we are expecting that he will be able enough to pronounce some words like A, like B, right? Or in our particular native language. But if your child is not able enough to respond at that particular group or at that particular station, then it means there is something going on, right? In excessive adults, mild severity level can be seen as having problem with the excessive functioning or executive functionings, multitasking. They won't be able enough for the abstract thinking. All right, cognitive flexibility would be lacking, or the short-term memory is not very comprehensible. All right, they would be having this kind of problem in terms of the conceptual station. But when we are talking about the social domain in terms of the mild problem, then obviously we are talking about the individual will be immature in the social interactions. All right, there will be some kind of difficulties in regulating the emotions and the behavior in age-appropriate fashion, right? And you will note this kind of difficulty in their peer interaction as well. So sometimes they are actually at very high risk for the gullibility, for being manipulated by the others, because they are emotionally, unfortunately, very sensitive, or you can say not very age appropriately compassionable. All right. So here comes the third domain of intellectual disabilities, and at the level of mild, that would be the individual may need some support with the complex daily living tasks comparison to their peers. Support is typically needed to raise their family at their adulthood. All right, they won't be able enough for the recreational activities like as compared to their age mates, although the judgment may be related to some of their well-being, or the organization around the recreational requires some support. But at the very adulthood, they will typically need some support to raise a family. All right. But when we are talking about the moderate version of deficit in adaptive functioning, we are actually talking about conceptual skills. In terms of conceptual skills, basically, individual may be lagging remarkably behind those peers. All right. For example, for the preschoolers, language or the pre-academic skills will develop slowly. All right. And the ongoing assistance on the daily living basis is actually needed to complete the conceptual task on day-to-day or the daily living. And the people actually have to be responsible for that particular individual. They have to take over the charge for them. All right. They will actually need your assistance. They won't need you to take over their responsibility remarkably. Let me be very clear about it. All right. Then comes the social domain. In the social domain, the moderate level of severity for the intellectual disability will be like seen as the peers' differences in the social and the communicative behavior across the development. Social language is typically primarily tool for the communication skills, as we all know, for the social communication, but it is far more less complex as compared to their peers. They won't be able enough to make a very huge paragraph for the communication. All right. They won't be able enough to actually manipulate that paragraph for anyone else. So, individual may not perceive or interpret the social cues very accurately, and the social judgment and the decision-making abilities are very limited for these individuals. Okay, and significant social and the communicative support is needed in work setting for the success in their adulthood. All right. So when it comes to the practical domain, when we're talking about individuals' practical learning or the practical daily living skill, and we have to talk about the moderate severity level, then we are actually expecting that the individual may require personal care involving the eating, dressing, or the hygiene as an adult. But let me tell you, with an excessive teaching period, with an excessive care, or you can say with an excessive reminder, a person can become very much independent in this regard. All right. They can be teaching it, they can be teach actually over a period of time. I know that require a very huge period of time and very huge practical skills, but we have to be patient as a clinical psychologist. We can work on them. All right. So whenever I'm talking about the intellectual disability, or whenever I have to actually communicate with the family to discuss the problem of their child as an intellectually disability, or you can say the intellectual developmental disorder, I will be just communicating with them that you have to understand, if we can actually learn a thing in 1 minute, or you can say in a very tetra minute, but those children are just a bit slow. They will need our assistant to repeat that thing in a far more less complex way, and they can actually learn that. But that would require around 25 minutes. It's just a matter of patience. All right. So here comes the third severity level we will be talking about, and that is the severe severity level. And at this level, the conceptual domain is actually the attainment of the conceptual skills is very limited here. All right. The patient or the individual having severe intellectual disability actually have a very limited version of the communication skills, or you can say the conceptual skills actually. They generally have a very little understanding of written language, and especially the numbers, or you can say the numerics. It can be in terms of quantity, it can be in terms of time, money, anything. But if it's numeric, then it's probably very high lightening. All right. And the caregivers have to provide a very extensive care for the problem solving throughout their life. All right. When we are talking about their social domain or the social pillar for the individual, we have to expect that the spoken language is quite limited in terms of vocabulary and the grammar. All right. And speech may be even single word or some kind of phrases, or even sometimes it's very blunt to understand few words. All right. Language is used for the communication, as we all know, but in such case, language is a very huge barrier to understand them. All right. Individuals understand very simple speech, and they just prefer to communicate in the gestral, or you can see the non-verbal manner. All right. Their relationship with their family members and the familiar others are just a source of pleasure, a source of love for them. All right. And they prefer those individuals around themselves. Then it comes to the practical domain. When we are talking about the practical domain of the intellectual disability, we are actually talking about the individual who would require support for all the activities of their daily living. All right, including their meals, including their dressing. We have talked about the moderate level. All right, they would require some assistance over the period of time that can dissolve, and the individual will be independent also. But at this particular period, individual required over the period of time. They actually require it for all their activities of their daily living tasks. All right. And the maladaptive behavior, including the self-injury, is very much present in those kind of individuals. All right. Then it comes to the profound level. There is a significant difference we have to actually understand between the severe and the profound severity level. That is, in case of profound, you would expect some co-occurring motor or the sensory impairments, all right, or some co-occurring, you can see the physical impairments as well, all right. It can be physical, it can be sensory, it can be motor impairment. Okay. Sometimes they may have some other coexisting disorder or the problem as well, including the genetic disorders like the Down syndrome. All right. So you have to be aware of this. So the patient with the profound level of intellectual disability, they generally involve the physical world rather than the symbolic processes. Um, Conceptual skills are well limited in these kind of individuals. All right, their goal directed fashion for the self-care and for the recreation is actually towards using some kind of objects to point out and just communicate about the source or for the need they require right now. All right. Then if we are talking about the social domain, then actually the individual have very limited understanding of the symbolic communication. We have talked about this where level. They have some kind of knowledge about the symbolic communication. Although they have a very limited level of the spoken language, but they have some kind of spoken, or you can say the symbolic communication. But in this regard, that's a very much limited as compared to them. The individual expresses their own desires or emotions mostly through their non-verbal, non-symbolic communication. All right. And they feel very happy to communicate with their familiar others. All right, they will just prefer those individuals around themselves. So when we are talking about their practical domain, we are actually talking about the individual who is totally dependent on others for all aspects of his life, including the physical care, hygiene, safety, protection, health, in all kind of their living skills. All right. So individuals without severe physical impairment, they may like assist with some daily work, but like carrying the dishes or like a very simple task, but not the complex command or multi commands. They won't be able enough to follow them. All right. So we have clearly talked about these domains. Here comes how we have to diagnose them. All right. We have studied about the criteria. Here it comes that individuals with the intellectual disability may have difficulties in managing their behaviors. We know, we have studied that they would be very much unable to manage their emotions, their interpersonal relationships. All right. Or their learning processes as well. But you have to understand that your diagnosis should be based on the both clinical assessment and the standardized testing of intelligence. All right. So here we have defined the intelligence and the previous relativity of the IQ and now the modern terms. The prevalence is actually intellectual developmental disorder are more common in boys as compared to the girls. All right. So yeah, and it's a very much important point that have been highlighted here. Removing the IQ ranges from the criteria meant that IQ can no longer be used inappropriately to define a person's overall ability, as we have discussed earlier. IQ, or you can say the intellectual coefficient, was meant to be just indicate someone's ability of their intellectual level, but that was getting stigmatized for the other people and they were being called as the mental retarded. So for that sake of the problem, it was being dissolute and it was renamed by the intellectual disability. All right. So then it comes another point, that is the cognitive profiles are generally more useful than a single full scale for the IQ. Describing the intellectual abilities, clinical training, and judgment are required for the interpretation of your test results. Your local standardized assessment tool will be preferred when you are talking about the standardized, or when you are talking about diagnosing an individual with an intellectual disability. All right. So let's move towards the DSM-5 TR. There are some highlighted points if you want to know about the sensitivity. About the specifiers in the DSM-5 TR, it has been mentioned clearly, as you have seen here. I have opened the DSM-5 TR. The specifiers have stated the various levels of the severity are defined on the basis of adaptive functioning, not on the IQ scores. Any kind of intellectual functioning or any kind of intellectual test or the IQ score will not determine the individual's performance or the individual's capacity towards the intellectual and adaptive functioning, because it is the adaptive functioning that will determine the level of support that is required. Moreover, the IQ measures are less valid in the lower end of the IQ range. Then here comes a second point that have been mentioned here in the diagnostic manual, that is the intellectual functioning is typically measured with the individually administered psychometrically valid, comprehensive, culturally appropriate test of intelligence. All right. These are the particular parameters you have to be aware of when you are talking about intellectual disability or when you are talking about diagnosing a person with an intellectual disability. All right. Then individual cognitive profiles based on neurophysiological testing, as well as the cross-battery intellectual assessment using multiple IQ or other cognitive tests to create a profile, are more useful to understanding the intellectual ability than a single IQ score. Now you have to understand that only the experts know it, that only practicing the Porter's Guide or the Vineland Adaptive Behavior Scale or even just a Bander's Gestalt test won't be enough to actually diagnose a person with an intellectual disability. You would require a proper cross-battery. You would require a proper local or a cultural-based assessment tool to actually create a profile of a person. All right? Okay, so let's continue from here. All right. As we have talked about intellectual disability, that the onset will be from the early developmental period, what is the basic age for the diagnosis of intellectual disability? Let me tell you, it's being very clear in the DSM-5 TR. It's 5 years. Before the age of 5 years, you are not in a compatible position to diagnose a person with an intellectual disability. All right. But in case if a person, or if being a clinician, you are actually facing that there are clear indications that the significant intellectual or general developmental delay is present, but your clinical assessment is not very accurate to level the reliable assessment, or you are not able to assess that level of reliable test, then at that period of time, at that moment, you are preferred not to diagnose a person with an intellectual disability. Rather than you have an other option, that is a global developmental delay. That is also a part of intellectual developmental disorder, all right? But it will include another version where a revised assessment will be required, all right? For example, you have a patient which is an under age of 5 years, and you have seen that we don't have a particular assessment tool to diagnose before the age of 5, and they require a proper developmental delay, and your clinical severity level cannot be reliably assessed. Then you have to diagnose a person with a global developmental delay, because in that case, a person would have to be assessed revisedly after a period of time, all right? And the individual who you will refer will also understand that actually the children or that individual is too young to participate in any standardized testing, all right? So this category will require reassessment after a period of time, all right? Then here comes another criteria, or you can say another category in the intellectual developmental disorder, that is unspecified intellectual disability, all right? In this diagnosis, basically a person over the age of 5 years who have significant intellectual or the general developmental delay or disability, but you are not able to actually reliably assess that person because of some kind of sensory or the physical impairment, like we have discussed in the profound severity level of the intellectual disability before, such as like the blindness or prelingual deafness, or you can say the locomotor disability, or the presence of severe problematic behaviors, or the any co-occurring mental disorder, then this category should only be used in exceptional circumstances in such kind of cases, and it will require a reassessment after a period of time, all right? Then here comes certain assessment recommendation. Let's just begin from here. After we will rejoin this meeting in 10 minutes, because Zoom time is gonna over soon. So let's just take a moment break. Thank you.